good day, sir. I'm Marian Michelle Sumailo Inding, and now I'm going to report or discuss lesson 1, which is intrapartum. So now, first, what is labor? Is the term for the changes in anatomy and physiology in the female reproductive tract that prepare the fetus and the placenta for delivery. And then, in the majority of cases, this happens when the baby is fully developed at full term between the 37 to 40 weeks gestations, or the otherwise is 9 months. So labor heralds the end of the baby's time in the uterus and the beginning of adaptation to life outside the mother. And then labor, also called childbearing, uh, childbirth rather. So is the process of your baby leaving to the uterus and you're in labor with you have regular contractions that cause your cervix to change. And then contractions are when the muscles of the uterus get and tight and then relax. Contractions help push your baby out of your uterus, and your cervix is the opening to the uterus that sits at the tip of the vagina. So, factors affecting the intrapartum experience. So there are 6 factors that maka-affect ang intrapartum. So first is experience. First experience. So some of the mothers have kanang wala pa sila experience sa childbirth or labor. Kay ngano? Kay lagi first time sila manganak, and then napoy uban nga mother kay ikapila na nanganak, so na siya experience kung unsa ka sakit ang manganak. And then sa kadtong wala pa, so naa jay possibility nga wa pa jud siya ka experience kay una pa lagi and mangulba dayon siya. So the second is culture. So ang culture, so this culture, some of mother have a high tolerance of the culture. So naadyoy uban nga kuan kayo, taas kayo ang tolerance sa lang culture. And then naapoy uban nga kanang uban bitang tawo nga napoy tinhuan nga dapat lagi daw ko mag-exercise paglakaw-lakaw kay paspas kayong delivery mga inana mo sa culture po na nila. And then sa pre-pregnant health and biophysical preparedness for childbearing. So kani importante ni siya because dapat ready na ang imong lawas sa pagka-mother nimo nga nagsugod na siya sa pagburos. And then kani siya dapat yun nga kung if nakaplano nga buros pod kay dapat 18 to 35 range yun na siya. So for example, 18 below ka, nandiyan possibility nga ikaw mo'y luoy or ang baby. And then sa inig ka 35 above na pug ka, napoy ko ang possibility nga luoy jud ang anak na ay mga kanang diferensya. So luoy na jud kay dapat ready na jud ka nga sa atong pagburos. And then sa motivations for childbearing. So kani siya kay dapat yun na to every mga anak dapat yun na to nga i-motivate yun na to sila kay naiuban nga walay mag-motivate nila makakuan dayon sila cause nga kanang hala wala jud gakuan ako gamot kanang care na ako. Then, so, maluya sila and then, makakuan nila yun sa baby. And then, dapat yun na to, nga, i-motivate na to sila, huwag na to silang side para makuan sila sa ilang pagpanganak. And then, sa socio-economic readiness. So, kani siya kay, kuan yun ni siya nga, kwarta ang importante. It is because kay kanang humana na siya labor or mga man siya panganak and then mugawasay na sila and ilang kwarta is kulang. So makakos jud siya og problem sa mother. And then, lastly, age of mother. So, kani sab siya katulagi parehas sila sa pre-pregnant health and biophysical preparedness for childbearing. So, excuse me. So, kani siya pareha na ni siya sa kuan sa age of mother. Dapat lagi nga ini magburos wa plano 18 to 35 range din na siya. Kaya for 18 below, so na possibility ang mama o kuan, ang anak, magka-problema, or ang kung pataas po ka 35 pataas, so ang baby mo'y na ay problema or so kana siya. So you need to be aware that labor may start at any time. So kaning siya kay dili jud nato mahibalaan nga kanang for example moana ang kuan nga karon ka mga anak kaning alas 12 ka mga anak ma'am. So dili jud na matag-an nga kana jud alas 12 nay mo extend ba or kanang mga 1 week before anha mga anak. So naa di jud nato mahibalaan ang pag deliver sa bata. Then at a rural health unit, 37 to 40 weeks is considered the normal window. At the hospital. It can be at 37 to 42 weeks with close follow-up using ultrasound scanning. Although it is good to calculate the expected date of delivery. So, as 40 weeks from the mother's last normal menstrual period. If she knows the date, many mothers do not. So, dagang kuan nga wala ka kuan sa date, then tell her that she is probably not going to deliver of the expected date. So, katulagi nga, dili jud na to mahibalaan ang pag-deliver sa bata. Kung kuan kay lagi wala jud nakakuan nga kanang makatag-an nga kani ma'am kaning mga naka sa kuan 3 p.m. So dili jud ang expected date and time. So only about the 2% ra jud ang natunong sa on point sa pag-deliver sa bata. For example, February 5 siya and the expected date is November 12. So kani siya 2% na ang nakakuan nga motunong jud sa expected date. Kay lagi wala jud nakakuan kay if katong I said nga earlier nga kuan mga 1 week pa anak pa mga anak, so wa jud makatagna. And then these are the kuan mga question. So what does labor occur? When is labor ongoing? To start. So kato akong giingon, so wala jud nakakuan sa mga researcher nga nakatubag nga kung kanus ayud ang labor mag-start, inana wala yun. Then what initiates, stimulates labor to begin is it factors and the fetus, the mother, or both. So kato siya. And then why do some women develop preterm labor? Why do kuan unpredicted labor abnormalities occur? So now we proceed to theories of labor onset. So first is the uterine stretch theory. So any hollow body organ when stretched to its capacity will inevitably contract to expel its contents, and the pressure increases, causing the uterine contractions. And then that initiate labor and results in release of prostaglandins. And then, kabalo man jud ta nga atong uterus is the hollow body organ kung mo stretch during the pregnancy. Then it is well contract to expel the fetus inside. So number 2 is oxytocin theory. So pressure on the cervix by the growing fetus stimulates the hypothalamus to release oxytocin from the maternal posterior pituitary gland presence of of contractions of the smooth muscles of uterus. So, kato, it is a hormone that helps the mother to have a uterine contractions. And then, number 3 is progesterone deprivation theory. So, progesterone is the hormone designed to promote pregnancy. It inhibits uterine motility. Progesterone is secreted to prevent uterine contractions that may disturb the growing embryo, and the hormone also prepares the breast for lactation. So, and the number 4 is theory of aging placenta. And then advanced placental age decreases blood supply to the uterus, and this event triggers uterine contractions, thereby starting the labor. So the placenta ages throughout the pregnancy. It will be decrease the blood supply to the uterus. They triggered na dayon sa uterine contractions. And then we proceed to ika-5. So, fetal cortisol or fetal adrenal response. So, when pregnancy reaches its term and the fetus produces more cortisol, cortisol, which causes slowing production of progesterone and stimulate the production of prostaglandin. So, an increase in the fetal adrenocorticotropic hormone levels at term is speculated to have an effect on uterine sensitivity to oxytocin and prostaglandin, so thus stimulating labor onset, slowing production of progesterone, and stimulate the production. So prostaglandin initiation theory or prostaglandin cascade theory. So this is the labor onset is initiated due to the production of prostaglandin as a result of the interplay between the adrenal, fetus, and uterus. And then for the coitus, so this is the sexual activity of the female. Semen contains prostaglandins that helps ripening of the cervix. So 8 is pressure on cervix. It is stimulate neural release of oxytocin. And then sa 9 is seasonal time influences. Ang may example ani which is mga full moon, low tide, and high tide. So, now we proceed to phenomena and process of labor and delivery. So, labor is a coordinated sequence of involuntary intermittent uterine contractions, and labor is the series of events by which uterine contractions and abdominal pressure expel a fetus and placenta from a woman's body. And labor and birth require a woman to use all the psychological and physical coping methods. And then sa delivery, so is the actual event of birth. So kani siya ang tinuod na jud ang paggawa sa fetus. So the common nursing diagnosis used during the labor. So we have the pain related to labor contractions, then an anxiety related to process of labor and birth, and then the situational low self-esteem and related to inability to use prepared childbirth method, and lastly is health-seeking behaviors related to management of discomfort of labor. And then, naapod tay a normal labor has the following characteristics. So, ang normal nga labor naapod kuan sa following characteristics. So, it's spontaneous onset and it begins on its own without medical interventions. And rhythmic and regular uterine contractions. So, And then vertex presentation or the crown of the baby's head is presenting to the opening cervix. And vaginal delivery occurs without an active intervention in less than 12 hours for a multi-gravida mother and less than 18 hours from primigravida, which is the first birth. And then no maternal or fetal complications. So, now we proceed to components of labor. So, naa diri ang passage, ang passage, passenger, power, and of course, the psyche, position, and placenta implantation. So, passage. So, this is the kanang refers to the route a fetus moves the travel from the uterus through the cervix and vagina to the external perineum. So naa diri ang gynecoid, platypeloid, antroid, and anthropoid. So first magkuan ko sa gynecoid. So it is a pelvis nga oval at the entlet and has a generous capacity and wide subpubic arc. And then this is the classical female pelvis or pelvic brim is a transverse ellipse nearly a circle most favorable for delivery. Ang gynecoid pelvis sometimes atong ginatawag og true female pelvis and it is found in about 50% of the women in sa Amerika. And then sa platypeloid, it is a pelvis nga flattened at the inlet and has prominent sacrum. And then only about 3% of women have a true and pure pelvis of this type. And then it is very difficult for these women to have really flat abdomen. So flat ilang abdomens, difficult yun sa iyo nila. And then android, it is a triangular in shape at the inlet with the narrowed subpubic arch. And now we proceed to anthropoid. So pelvis is like the gynecoid pelvis, basically oval at the inlet, but the long axis is oriented vertically rather than side to side. So side to side siya. And then the subpubic arch may be slightly narrowed. This pelvis favors occiput posterior presentation. So kaning upat ka kuan sa passage ang the four types of pelvis, the gynecoid is the most favorable for delivery. And then ang tulo ang nabili na which is the platypeloid, android, and anthropoid kay mauni sila ang mga cesarean. So we proceed to passenger. The passenger is the fetus. So ang passenger kay ang fetus. So this is the kuan sa picture nga skull sa fetus. So diri ang kuan anterior anterior, so kani siya murag na space, and then this is the kanang bone, frontal bone, then parietal bone, then occipital bone, and temporal bone. So kani siya ang face, kani siya, then brow, then vertex, kani siya diri nga then occiput. So na siya ang skull sa fetus. And then we proceed to fetal attitude. So it describes the degree of flexions a fetus assumes during the labor or the relations of the fetal parts to each other. And then so mo ni siya ang picture sa vertex or full flexions, then sensiput, moderate and flexions, then military attitude, and then brow partial extension, and face kani for flexions and complete extension. So naay upat ka book nga ginatawag nato sa fetal attitude, which is the good attitude, moderate flexions, partial extension, and complete extension. So, ang good attitude, so kato if naka-flex ang baby, there's is a good attitude and tarong man ang position and then smooth po siya. And then sa moderate flexions, this position cause nga makakuan siya og the next widest anteroposterior diameter the occipitative frontal diameter 2% to the birth canal. And then ang partial extension presents the brow of the head to the birth canal, so gahangad ang baby. So which is ang partial is extension is gahangad ang baby, and then ang complete extension, this unusual position usually presents too wide a skull diameter to the birth canal for vaginal vaginal canal for vaginal birth. So kani siya is nakakuan na jud siya, naka-extend na jud siya. So sa fetal line na ta, we proceed to fetal line. So lie is the relationship between the long axis of the fetal body and the long axis of woman's body. In other words, whether the fetus is lying in a horizontal or a vertical longitudinal position. So, approximately 99% of fetus nga nag-assume sa longitudinal lie with their long axis or parallel to the long axis of the woman. So, longitudinal lights are further classified as cephalic, which means the fetal head will be the first part to contact the cervix, and or breach with a foot or the buttocks as the first portion to contact the cervix. So there are two types of fetal lie. So the first is longitudinal and the second is transverse. So the transverse kay naka-horizontal ang longitudinal axis sa baby, which is naka-head to toe na siya. And then sa transverse is naka-perpendicular ang mother and baby. So kani ang picture sa longitudinal line vertex presentation. So kani, and then sa longitudinal line breech presentation, and kani siya sa shoulder presentation. So kani siya, kani nga picture ako nang i-discuss sa ako ang next nga slide. So there are types of fetal presentation. So it refers to the body part that will first contact the cervix or to be born first, and it is determined by the combination of fetal lie and the degree of the fetal flexions or the atong ginatawag og flexion attitude. So first we have the cephalic. So ang cephalic is the most frequent type. And then 95%. So ang types niya kay ang vertex, the head is sharply flexed, making the parietal bones or the space between the fontanelles is the presenting part. And then this is the most common presentation and allows the subcupitobregmatic diameter to present to the cervix. And this is a good attitude because naka-flex lagi ang baby, ang fetus rather. So ang brow is brow because the head is only moderately flexed and the brow or sinciput becomes the presenting part. So, the attitude of this is moderate flexion nga bro or sinciput. And then face, the fetus has extended the head to make the face the presenting part from this position, and extreme edema and these distortions of the face may occur. This position is kahangad ang baby. And then for the mentum, the fetus has completely hyperextended. So kato kay nakahangad na siya. So ang mentum kay naka-hyperextended na gyud ang head sa fetus to present the chin and causing the presenting diameter or the occipitomental to be so wide that vaginal birth may not be possible. So katulad yung giingon earlier nga kuan ga hangad yun ang fetus. So now kuan na ta proceed na ta sa breech presentation. Either the buttocks or the feet are the presenting part or 3% na yun siya. Then, ang types of breech presentation is na ay complete, extended, footling, knee or kneeling or others. So, ang complete kay incidence to 10% of the term nga of the term and preterm breeches. So the baby sits cross-legged, so naka-cross ang iyang leg with flexed knees and hips, and feet are tucked up against its bottom. And then this position is most common in multi-gravida. And then sa extended kay ang incidence is 45 to 50%. So the baby's legs are flexed at the hip butt with straight knees. The legs lie alongside the trunk. And this position is most common in prima gravida. Near term is knees flexion is restricted by firm uterine and abdominal muscle. And then sa footling kay incidence 20 to 25%. So one or both knees and or hips are extended with one or more feet below the buttocks. And then sa knee or kneeling kay one or ang incidence niya is 5% of term of breeches. So one of both hips are extended and the knee ang iyang knee is naka-flex ra, and then the knees are the height of or below the buttocks. This is the rarest position. Ang pinaka-rarest nga position is knee or kneeling. Mo yun ang pinaka-rarest nga presentation. And then for others, occasionally a presentation may be compound one leg or footling. So now we proceed to shoulder. In a transverse lie, a fetus lies horizontally in the pelvis, so the longest fetal axis is perpendicular to the mother. So the presenting part is usually one of the shoulders, or we call a common process. An iliac is a hand or an elbow. So the usual contour of the mother's abdomen after may appear fuller side to side rather than the top. So types of fetal position. So position is the relationship of the presenting part to a specific quadrant of woman's pelvis. So naadiri ang types and landmarks. So ang types kay right anterior, left anterior, right posterior, and left posterior. So kaning right anterior and left interior ug asa dapit nag-atubang ang fetus naa ba sa left or right anterior kung ang anterior is ang nag-atubang ang baby sa back sa mother. And then, ang landmarks is vertex, occipit, then face chain, then mentum. So, and then breech or sacrum, shoulder scapula, or acromion process. So, the middle letter denotes the fetal landmark. So, occiput, M is mentum or chin, SA is sacrum, and A is acromion process. So, acromion process first letter defines whether the landmarks points anteriorly, A, posteriorly, P, or transverse is T. Ang mga kuan niya nga kuan kay A, P, T. So, APT, which means anteriorly, posteriorly, or transversely. So, mo siya. So, position is important because it influences the process and efficiency of labor. So, kani siya nga kuan, kani nga picture, dapat mo ni siya mga examples nga possible sa fetal presentation. So, kato siya lagi na vertex presentation, occiput, then breech presentation, ang sacrum, ang shoulder presentation, which is acromion process. So, mo ni siya ang atong i-familiarize pod. And then, kani nga peak is nakakuan siya sa kani siya nga peak. So, kani siya nga peak, mo ni siya ang mga sa LOP, LOT, LO kuan siya. So, now kuan maka sa mechanism of normal labor. So, engagement. So, is when the fetal head enters into the pelvic inlet and then the head is said to be engaged when the parietal diameter measuring ear tip to ear tip across the top of the baby's head. So, muna siya ang iliac crease, mga anterior superior iliac, then ilium, so both ilium na sacral promontory, kani siya, then sacrum, kani siya nga part, and then ang coccyx, kani siya, and then kani siya pubic bone, pubic symphysis. So, descent. The term fetal descent is used to describe the progressive downward movement of the fetal presenting part, commonly the head through the pelvis. When there is a regular and strong uterine contraction and size of the baby's head and the size of the mother's pelvic cavity are in proportion, so the baby can pass through, there will be continuous fetal descent deep in the pelvic cavity. So, for the molding, the fetal scalp bones undergo overlapping at the suture lines in order to allow the head to pass through the narrow space. So, flexion. The movement known as flexions occurs during and is brought about by the resistance felt by the head against the soft tissues and bones of the mother's pelvis. So, smaller flexions and then sa internal rotation. So, as the head reaches the pelvic floor, it typically rotates to accommodate the change in diameters of the pelvis. And then at the pelvic inlet, the diameter of the pelvis is widest from the right to left. And then at the pelvic outlet, the diameter is widest from front to back. So, sa unahan o sa likod. So, the baby moves rotate from lying sideways to turning its face towards the mother's backbone. And then when the rotation is complete, the back of the baby's head is against the front of the mother's pelvis sa mothers, and the sagittal suture in the fetal skull is no longer at an angle, but points straight down towards the mother's backbone. So, ang internal rotation, because it occurs while the baby is still completely inside the mother. And then sa extension, kay after internal rotation is complete, the baby's head passes through the pelvis, and uh, a short rest occurs when the baby's neck is under the mother's pubic. So ang extensions of the baby's head and neck occur, the neck extends and the chin is no longer pressed against the baby's chest, and the top of the head, face, and chin are born. So, for the external rotation, after the head of the baby is born, there is a slightly pause in the actions of labor. During this pause, the baby moves rotate so that his or her face moves from the facing the mother's backbone to facing either of her initials. So ang external rotation, because part of the baby is already outside of the mother, it is called a restitution. So restitution. And then the rotation is necessary as the baby's shoulders moves feet around and under the mother's pubic bone. So, kato siya. Then, now we proceed to expulsion. So, almost immediately after external rotation, the anterior or shoulder moves out from the pubic bone. And then, the mother's perineum becomes distended by the posterior or second shoulder, which is also born. So, kani siya is, kuan na yun ni siya is, nakagawas na jud ang baby. So, almost immediately after external rotation, the anterior foremost shoulder moves out from the under the pubic bone, and the mother's perineum becomes distended. So, kato, makakuan siya distended by the posterior second shoulder. So, now we proceed to the powers of labor. So, the third important of the requirement for a successful pag-successful sa pag-deliver sa child, sa baby, sa fetus rather, is effective powers of labor. This is the first supplied by the fundus of the uterus and implanted by the uterine contractions, which causes cervical dilatation and then expulsions of the fetus from the uterus. And then we have the phases of uterine contractions. Increment. So when we say increment, when the intensity of the contractions increases, and the acme is when the contractions is at its strongest, and the decrement when the intensity decreases. So, now sa contour changes. So, as labor contraction progress and become regular and strong, the uterus gradually differentiates itself into two distinct functioning. So, naay into two distinct functioning, which is upper portion and lower segment. So, the upper portion, which is thickness, and then while the lower segment, which is becomes thin-walled, supple, and passive, so the fetus can be pushed out of the uterus and uterus easily. So the contour of the overall uterus also changed from a round ovoid structure to an elongated one with a vertical diameter marked markedly greater than the horizontal diameter. So now we proceed to cervical changes. So even more marked than the changes in the body of the uterus are two changes that occur in the cervix, mm, in the cervix, effacement and dilatation. So effacement is a shortening and thinning of the cervical canal. All during the pregnancy, the canal is approximately 1 to 2 cm long. So 1 to 2 centimeters ang kataas-on. So, ang dilatation refers to the enlargement or widening of the cervical canal from opening a few millimeters wide to one large enough and approximately 10 centimeters to permit a passage of the fetus. Ang ang dilation kini siya ang katong ginaihap ang kuan sa progress sa mother. So kani ato silang ipa-rate which is 1 to 10 and the 10 is a full nga nakuan sa mother. So how do you know that true labor has begun? So characterized by regular rhythmic and strong uterine contractions that will increase progressively, and then adequate urine contraction. So, ang adequate urine contractions na diri naa ang frequency, duration, and intensity. So, first we talk about frequency. So, frequency is uterine contractions will be 3 to 5 times in every 10 minutes. So, 10 minutes period. And then for the duration, each contractions lasts 40 to 60 seconds. And then for the intensity, contractions feel strong. So, kuan na siya, feel strong na yun siya. And then, sometimes the mucus and a little bit of blood drip out of the vagina. This is called show. And then true labor may be spontaneously established with or without show and with or without leakage on amniotic fluid. And then, so if the labor has not started or not progressed much within the 6 hours after the waters break, refer the woman to a higher health facility as soon as possible. And then, nadiri sa next slide kay nadiri ang characteristics, nadiri ang true labor and false labor rather. So, uterine contractions. So, occur at regular intervals, but the interval between each contraction gradually becomes shorter. And then, duration of each contractions gradually increases. So, intensity of the contractions become stronger and stronger. So, ang false labor is contractions occur at irregular intervals. So, irregular ang intervals. So, durations remain unchanged, either long or short. And then intensity remains unchanged. So, sa cervical, another cervix progressively dilates and cervix does not dilate, remains less than 2 centimeters. And sa pain is discomfort at the back in the abdomen cannot be stopped by strong anti-pain medication, or sa false labor is discomfort is non-specific, has no particular location, and is usually relieved by the strong anti-pain medication or by walking. And then this psyche is the fourth or a woman's psychological outlook and refers to the psychological state or feelings a woman brings into the labor. And so, for many women, this is a feeling of apprehension or fright. For almost everyone, it includes a sense of excitement or awe. So women without adequate support can have a labor experience of frightening and stress. So stressful yun, that they develop as symptoms of post-traumatic stress disorder or PTSD. So, unsa atong buhaton, what to do? So, we have to encourage women to ask question at prenatal visits. So, ato yun siya, ato silang pangutanon sa mga pangutanon sa prenatal visits nila. And then, and to attend preparation for child. So, sa pag-prepare na sa childbirth classes. So, they are as well prepared for labor as possible. Then we also encourage them. So we also encourage them after birth to talk about this, share their experience because a deep briefing time and can be important way to help them appreciate everything that happened and integrate the experience in their total life. So, naa diri ang stages of labor. So, the first stage of labor is cervical opening stage, and the second stage of labor, the pushing stage, ending in the birth of the baby, of course, and the third stage of labor is the birth of the placenta, and the fourth stage of labor is the first 4 hours after birth. So, now magkuan ko sa first stage of labor. So, it is the first stage of labor is characterized by progressive opening of the cervix, and which is dilate enough to let the baby out of the uterus. And then for most of the pregnancy, nothing can get in or out of the cervix because the tiny opening in it is plugged with mucus. And then so, natin dire epicament, cervical dilation, and Latin phase. So, ang epicament, the cervix stretches and gets thinner. And then sa cervical dilation, the cervix then dilates, the diameter gradually increases. This known as cervical dilation. Each time in the uterus contracts, it pulls a little bit of the cervix up and open. And then the Latin phase. The Latin phase is the period between the start or irregular rhythmic contractions up to cervical dilation of 3 cm. So, during this phase, contractions may or may not be very painful, and the cervix dilates very slowly. And the Latin phase so ends with the rate at which the cervix is dilating speeds up, and this signals the start of the active phase. So, kato siya. Ang active phase is said to be when cervical dilations occurs more rapidly and increasing from the 4 centimeters to 7 centimeters at a rate of about 1 centimeter per hour in multipara and 2 centimeters per hour in nulliparas. Ang 1 cm then ang 2 cm per hour is multiparas. So, kana siya. And then, so the second stage begins when the cervix is fully dilated 10 cm and is completely when the baby is completely born after the cervix is fully dilated. The mother typically has the urge to push her efforts in bearing down with the contractions of the uterus move the baby out through the cervix and down the vagina, and this is known as fetal descent, and the rate of fetal descent is an important indicator of the progress of labor, which will be described in more detail later. Then the average duration of second stage is 1 hour and actually not longer than 2 hours. So the third stage of labor is the delivery of placenta and membranes. After the baby has been born, the duration is usually a maximum of 30 minutes. And then sa fourth stage of labor, the first 4 hours immediately following placenta delivery are critical and have been designated by some experts as the fourth stage of labor, and this is because after the delivery of the placenta, the woman can have torrential vaginal bleeding due to failure of uterine contractions to close off the torn blood vessels where the placenta detached from the uterine wall. Therefore, you should be vigilant to detect revealed or concealed postpartum hemorrhage and manage in accordingly. So, maura to sa first, second, third, or fourth stage of labor. So, so thank you for listening, sir. So, bye, sir.